Good afternoon, everyone. I'm Dr. M Yusuf, cardiac surgeon in Chennai and in Apollo Group. I specialize in minimal invasive cardiac surgery and robotic heart surgery. I also have a passion and work on aortic surgeries and mitral valve repair surgeries. I would like to thank Health Travelers Worldwide team for giving me this opportunity. Today I will discuss about just give a little bit of introduction about COVID and the situation now, what precautions we should make as citizens of the country and the world. Also, then a little briefing about cardiac problems that we come across and prevention measures. Then on what symptoms we need to really be worried about and be contacting medical help during this lockdown period. After this brief session of about 15 minutes or so, I'll be able to take questions from any of the audience. During this initial period, I would prefer to talk through the information. So, this coronavirus strain COVID-19 has really brought the whole world to a standstill, as we all know. What do we need to follow or what precautions we need to take? Mainly, this virus spreads through aerosol. So, coughing, sneezing, and the aerosol produced from human to human. This is the reason social distancing has become the buzzword in this time of the year. So, these aerosols can pass on from person to person while coughing or sneezing if they're too close to each other, or it can settle on surfaces, any surface for that matter. And these viruses stay alive on any surface for number of hours depending on the surface. Metal maybe a bit longer, clothing a little less, so all that. It's for this reason we have been asked to wash, clean whenever we touch anybody or any surface, washing our hands, all those precautions. So, social distancing is the key. So, what do we mean by this social distancing? We need to keep certain distance between people. So, you say at least 2 to 3 meters to prevent this aerosol spread. And that's the reason we have been asked to stay indoors, stay at home. Because in our population, when we get out, it's very difficult to maintain this. And our government has taken excellent measures from starting this lockdown very early compared to a lot of Western countries which did not follow early, and the other being also trying to make it happen. Lockdown for a 6 to 8 weeks period is not an easy decision, but that's something we all need to understand the importance and follow. So stay indoors as much as possible. Within your house, you don't need to wear a mask. Mask prevents spread. So when we go out of the house, yes, because you don't know who is infected, who are carriers. Not every carrier of this virus shows symptoms. So that's the reason we have been advised to wear masks when we go to public places. We being doctors, we do when we go to hospitals as well. We are only treating emergencies now, mainly for the reason patient safety, healthcare worker safety, and so on. So that's about social distancing. Stay away from each other, but at home you don't need to wear mask. But when you get out, try not to get out as much as possible. Try to get out only whenever it is really, really necessary. So I think once or twice a week should be adequate to get whatever basic needs we have to get. So that would be one important thing for each one of us to follow. And the other thing, wash hands, keep yourself clean. Try not to touch your face, nose, mouth, where these aerosols might be prevalent, even if we are silent carriers. Now, going on to our chapter, cardiac disease. So, I will first brief about generally what things to look for, risk factors, precautionary measures, and then what to do in COVID situation. So, for a general population, in India, cardiac disease is most prevalent compared to any other country in the world. Apparently, WHO says we have about 50% of the population of coronary artery disease currently in our part of the Asian subcontinent. The other problems apart from coronary artery disease, which is really leads to heart attack, are valvular heart disease, which is a completely other problem. There are coronary artery disease is a problem when blocks arises in the blood vessels supplying blood to the cardiac muscle, which helps in pumping of the heart. The valve problem is there are four chambers within the heart, and each chamber has a valve, inlet outlet valve, to aid unidirectional flow. If there is any blockage or leakage in these four valves, that is valvular heart disease, which is much less compared to coronary artery disease. So, what are the risk factors? So, there are five major risk factors for coronary artery disease or cardiac problems. Diabetes is the major factor, high blood pressure, high cholesterol, smoking, and a family history. So, of these, definitely smoking is within our hands. Not smoking is the biggest killer. It not only affects the heart, it affects the whole body. Please do not smoke. Especially if you have a family history of heart disease, it puts anyone at a very high risk of having a heart attack and reducing the lifespan of the person. Smoking can be avoided. Blood pressure, sugar, cholesterol can be controlled by following lifestyle measures, sensible eating, and if patients are already diagnosed with any of the problem, proper medications. So lifestyle measures generally are sensible eating. It's not about diet, it's about eating sensibly. Low fat, high fiber diet and less oil and on a general day-to-day basis, and less stressful lifestyle. I know we all run around money, but that is not the our lifestyle. We should take care of ourselves to be around to take care of our family. That is important rather than running behind any factor in life. So, lifestyle, less stress, more activity. Try to make compulsory activity in your day to day life rather than going to walk or run for an hour or half an hour, which most people don't do. Try to include activity within your day to day work, like avoid lifts in your workplace. Try to walk at least 10 to 15 minutes to work. If you want to get down previous station in train, or park your car a little away and walk. So these sort of things will include your activity within the day-to-day life and help in active, healthy lifestyle. And finally, tablets only if required. So diabetics, if someone is diabetic or have a strong family history of ischemic heart disease, patients with high cholesterol or blood pressure preferably should have health checks once every year or at least once in 2 years after the age of 40. Patients with any of the more than two risk factors, preferably after the age of 30, at least once in 2 years, and then follow whatever the doctor mentions or prescribes. So that's about in general. And in patients who have had heart disease or have had who are on medications for heart disease, for any heart disease, there are three forms of treatment: tablets, interventions by cardiologists like stenting, angiography, and surgery. So each patients are treated according to their symptoms and the problems that are. If it is mild, then tablets usually. Intervention or surgery depends on the nature of the disease and uh, what is required to be treated. I can see questions coming up, but I will definitely answer them shortly. So let me finish this in another 5 minutes or so, even regarding the lockdown. Okay. Right. So, in patients who have undergone previous surgery or intervention, it's very, very important to follow the medications. Current cardiac disease is not like any other orthopedic or general surgery where you have the intervention or surgery and then forget about it. No, it is a disease process in the body, especially coronary artery disease, and we have to keep it at bay. For that reason, lifestyle modifications, tablets, and sensible eating, all three factors are equally important to prevent the progression of the disease. By inserting a stent or by performing surgery, bypass surgery for that matter, we are only treating the problem, which is the blockages. But for further problems or blockages to not come on or to prevent further problems or blockages, we have to keep the disease process under control. It is for these reasons the three factors have to be followed for lifetime. Cardiac patients have to take tablets for lifetime. They have to see the cardiologist on a regular basis and follow their advice. It's not that they have to bump into them regularly, but from time to time, usually 3 months, 6 monthly intervals, or yearly intervals, as per the patient's condition. And what do we need to be worried about during this time of lockdown and COVID infection? Common symptoms for any cardiac problem, coronary artery disease or valvular heart disease, are mainly four: chest pain, which usually is not like a sharp pain. If you feel it's like a sharp pain, like pin or knife poking on the left side of the heart, then it's highly unlikely to be a cardiac related pain. It's usually like an ache or like a tight rope crushing your chest or like a heavy weight being kept on the chest. Usually it's around the central chest and it keeps spreading. It can spread anywhere. This is a typical presentation, but it doesn't have to always be typical. And usually this kind of chest pain is associated with an uneasy feeling of fear, sweating, nausea, vomiting. These are the common symptoms. Some people can present atypically without any pain or just blacking out and fainting. So those are atypical, but this is the type of pain you should be really worried about. And even more so if it doesn't settle by resting. If you sit down or rest and if it settles down, well and good. If it doesn't, then you need to seek medical advice as an emergency. If it settles down, then it is better to consult your doctor at the earliest. In this period of lockdown, health travelers worldwide has got teleconferencing facility, which is something you can really take on to. So there, they will medical doctors will be able to clear whether you need to seek emergency advice or not if your patient is stable. That's chest pain, first symptom. Second symptom is shortness of breath, breathing difficulty. So breathing difficulty can be acute, which can make you bring panic attacks, or it will usually show as symptoms your regular activity which you have been doing for months will be reduced. Even when you climb two or three steps, you might feel a little more out of breath. or even when you walk short distance, which was not happening earlier. So that's something of a concern. And also, patients will not be able to lie flat in bed. They might need extra pillows, or they might wake up in the night with breathing difficulty, have to sit up. These are symptoms of heart cardiac related problems as well. Other problems can be palpitations, where someone feels the heartbeat racing, cough at night, and sometimes, as I said earlier, it can present as faint attacks. Usually, cardiac and valve related problems uh, can present as faint attacks. So, the common symptoms are chest pain, breathing difficulty, palpitations, feeling the heart race, faint attacks, or cough at night. So, these are the common symptoms. So, during this COVID period, if you have noticed any of these changes over the last few days or weeks, then it's not an emergency. You can consult over telemedicine and then go to hospital as required. You can go to the hospital as soon as possible. But if you have chest pain which is not relieved at rest, as I mentioned to you, or acute breathing difficulties or palpitations, faint attacks, then you seek emergency help, call the ambulance, go to the specialist, get things checked out. So that will be an introduction to what I have been preparing to mention today. Now I am quite happy to take questions. So let's start off with the questions that I have. So there have been questions about minimally invasive surgery versus open surgery. I will try to come from as they have come on from the beginning. So yeah, one common question which probably I should have addressed with, but I haven't. How can old people take care of their heart while we have limited mobility? True. So there, exercising is very difficult in those yoga and exercise within the house like Surya Namaskar or our regular stretching exercises, dance within the house. These exercises can be very helpful. Yoga and meditation can be really helpful for young as well as old people. This lockdown has really brought in a lot of our old values of life, made us rethink and reflect back. I think we have to really make use of this time, getting together as a family, getting to do things together as a family, yoga, meditation, reflections, those kind of things. So that's yeah. The specific foods about food to be avoided, I think I've already mentioned low fat diet and also less oil. That is something to be really uh, to be followed on the long term. A lot of green vegetables, good vegetables and fruits. Fruits in diabetic people, better to take your diabetic advice and follow as per the doctor's advice. So fresh air and oxygen, that's another question. How can we get fresh air? That's ample. I think the general environment is getting cleaner as well. It's for the world to get back to normal. So just don't sit in the air condition round the clock. Try to stand out, open the windows, leave the windows open. I know it's quite warm during the day, but mornings and evenings you can leave the doors open. So these are simple measures that we can follow. That I think I've already mentioned. So regarding heart attack, I think that someone has asked, how do I know I'm having a heart attack? These are the main symptoms as we already discussed. And someone has mentioned, requested benefits of minimally invasive versus open heart surgery. That's something I would really like to talk today, being a minimally invasive surgeon. About minimally invasive cardiac surgery, it is a specialty on its own. In our country, it is still in its infancy. It's well established for over a decade in the Western world. So, what are the problems that can be treated by minimally invasive surgery? Most problems that require open heart surgery can be now treated without open heart surgery by minimally invasive surgery, which is minimally invasive surgery is when we make tiny cuts like laparoscopy on the left or right side of the chest and do whatever has to be done through open surgery within this small hole, through this small hole, with the aid of either robot or thoracoscopic camera. The patient stays in hospital for just 2 to 3 days and can go home with very little pain because there is less tissue trauma, less blood loss, and they return back to normal activity within 2 weeks. That's the biggest advantage. At the end of 3 months, both may be the same, but the whole trauma, pain, blood loss factors completely are reduced significantly by minimal invasive surgery, and the fear factor of cutting the central chest bone is avoided. So almost my practice, more than 70% of patients we treat through minimal invasive surgery, and that open surgery is not required in most patients in this day and age. But unfortunately, as I said, we have very few surgeons trained in our country. It's slowly coming up. And probably in the next 10 to 20 years, there will be more surgeons who can perform it well. And we in Apollo Chennai are one of the biggest centers performing these procedures. Yes, somebody has asked the difference between cardiac arrest and heart attack. Cardiac arrest is a term given, yeah, on its, as it mentions itself, the heart stops beating. So the patient is literally not functioning. That is cardiac arrest. Heart attack is when there is not enough blood supply to the heart muscle and a part of the heart muscle dies. So that is death of the heart muscle is heart attack. Stopping of the heart is cardiac arrest. So the effects of both. Cardiac arrest leads to patient death if it's not immediately acted upon. So what happens is that when the heart muscle, the heart stops pumping, brain can only withstand maximum up to 3 minutes without glucose to it, without blood supply to it. So in cardiac arrest, if the patient is not revived within 3 minutes, then the patient becomes a brain dead patient, which then leads to death. So that is one thing. And so cardiac arrest is there is stopping of the heart, so there is no blood pumped out of the heart. That is cardiac arrest, which can immediately lead to death if it's not acted upon right away. Whereas heart attack is death of part of the heart muscle. If it's a very small area, most patients recover and the heart function recovers. If it's a bigger area, it can lead to cardiac arrest. So myocardial infarction or heart attack can lead to cardiac arrest. And if it's a bigger part of the heart muscle that is dead, that can lead to poor heart function. I hope that is clear. Are cardiac patients more prone to corona infection? No, not that we are aware of. But in patients who have undergone transplantation or are immunocompromised, patients who are on medications like steroids or immunosuppressants, yes, they may be more prone, but not generally cardiac patients. And there have been speculation about one or two medications in cardiac patients which may uh, make the patients more vulnerable to coronavirus infection. But again, there is no clear-cut evidence on that. So medications like non-steroidal anti-inflammatories and some of the ACE inhibitors, but that's not been proven clearly. But there have been speculation about that. And can acid reflux and blood pressure affect the heart? Acid reflux does not directly affect the heart, but blood pressure, yes, as I said, high blood pressure is one of the risk factors among the five to cause coronary artery disease. So somebody has asked about who is a candidate for minimal invasive cardiac surgery. As I have said, most patients these days are suitable for minimal invasive cardiac surgery, but they have to be carefully assessed, as more than 70% of patients in this day and age. So there are certain factors where we would avoid minimal invasive cardiac surgery to in the best interest of safety of the patients, but that's only about 25% of patients. Most other patients can be treated by minimal invasive cardiac surgery, but they have to be carefully chosen by experienced surgeon who perform them regularly with good outcomes. Somebody has asked, my friend is obese and blood pressure issues. Losing weight will help him being less prone to corona? No, not really. Coronavirus infection, let me make it clear here, is mainly respiratory tract infection. So infection affects the upper and lower respiratory tracts. In delayed stages, it affects the lungs. When it affects the lungs, then it from there it affects the whole body through the spread of the infection, sepsis. So it is mainly uh, affecting the lungs, but yet yes, it can affect other organs of the body, but it's predominantly the lungs. It can affect. There have been cases reported with heart inflammation, myocarditis. Patients can present with cardiac arrest but with corona infection. Yes, it has. There have been many reported cases in the US. In other countries, not as much. So it can affect the heart directly without much lung symptoms, but that's very rare. Commonly, it is upper and lower respiratory tract infection. Yes, so the how does the heart muscle die? Yeah, it is. There are blood vessels, three blood vessels supplying blood to the heart. So when there is, it's like any other muscle in the body. You get cramps when you walk for long without regular exercising. That's because there is not enough oxygen being provided to the muscles. Every tissue in our body needs oxygen supply. Blood is a carrier, it's transporting agent carrying oxygen to these tissues and carries back deoxygenated blood. So that's what it does. So the heart muscle pumps the oxygenated blood which it collects back from the lungs and also acts as a reservoir. The right side is a reservoir, left side is a pump of the heart. So the left side is the reservoir for the old blood or the deoxygenated blood, which it then pumps into the lungs, gets back the oxygenated blood and pumps it to the body. So when there is not enough oxygen supply to the heart muscle, that's when the heart muscle, it's like a gangrene. It gets black and it dies. So that's how the heart muscle dies. If my BP medications run out and I'm not able to get them during lockdown, is it okay for me to not to take my medications for a few days? No. It is very important to try and not miss any of the medications. So any of the medications during this time. So it is not advisable to skip medications. It's very, very important. And now I think government has made very good measures for medicines to be delivered directly, even in case of elderly people. Please make use of them. I think just look into the government measures and their websites in every state. They are extremely helpful. There are lots of measures being carried out. Lockdown is handled in the best possible state. We can never be perfect, but try to make use of whatever is available in your local region. And there are lots of young volunteers who are ready to help as well. Please make use of them. We do not skip medications. How many heart attack How many heart attack can a patient withstand? Yes, it is difficult to say. If it heart attack, as I said, if it only affects a small part of the heart muscle, it may not cause much problem. But repeated heart attacks can lead to heart failure. By heart failure, I mean the pumping of the heart gets low. So that in itself is a major problem. If it's not treated early, then the patient gradually deteriorates over a period of time. Two problems can arise by ischemic heart disease. One, heart attack, which can lead to heart failure or heart or death. And over a period of time, if the heart muscle is not getting enough blood and blockages are not addressed early, that can lead to heart failure, which slowly will lead to multi organ failure and uh, cause problem or death of the patient. So it is very important to address these problems yearly. There are multiple various measures which have been coming up, but none of them have proven to be evidence based. The current available treatment for any cardiac problem are uh, medical therapy or interventions through cardiology, angioplasty, and surgery. No other medication or therapies have been proven to be efficient as of date. Sorry, I'm just going to change my earphone. Yes. No, கேக்குதா? So, is it possible for young, healthy people in the 30s to die of a heart attack? Yes. Heart attack can be, it doesn't only rely on age. It can be in young age, it is even more um, aggressive because not many young patients, it's usually cardiac disease is a disease of the elderly. But unfortunately, in our country, we are seeing a lot more young patients. As you might have known, I have practiced for over 20 years, trained and practiced abroad in Western countries. I've returned back about 5 years ago to India. It was a shock to me to notice we have a lot of patients between the 40 to 60 years age group, which is the breadwinning years in most patients' life, in person's life. In Western countries, more commonly patients are over the age of 65. But it's unfortunate in our country, we are seeing a lot of young patients, and that may be because of the uh, risk factors, as I mentioned earlier, diabetes, poor lifestyle, and poor dietary habits. So please try to follow a good lifestyle and try to keep ischemic heart disease, which is one of the biggest non communicable disease problems we are facing in our country. Is diet restricted after bypass surgery? Yes, definitely. As I said, after any cardiac intervention, stent or surgery, or even patients who are on medications, it's very important to follow three things. Again and again, I want to repeat these three things. One, tablets on a regular basis, dietary restrictions, which is avoiding fatty food and oily food, lot of vegetables to be added in the diet, and healthy lifestyle. So lifestyle changes, which includes activity and exercise, food habits, and tablets. All three things are very important in any patient who has risk factors for ischemic or heart disease, as well as who are on treatment for heart disease, either it be tablets, intervention, or surgery. Is it possible? Arabic patient is asking that she is using medicine for urine. If she stops it, swelling in heart will come back or not? Yes, it will. If it is due to it's, I think you're mentioning about diuretics. If it is due to heart failure, which usually is the case, then yes, you should not be stopping it. And these patients who are heart failure have to be reviewed by cardiologists on a very regular basis. Please do not skip. There are various treatments available now. A lot of patients with heart failure can be improved with the current medications. There are multiple medications which include our knee therapy, and those are tablets. So these medications help a lot in treating heart failure, in avoiding going patients on transplant or other major procedures. So please follow doctor's advice if you have a cardiac problem. Patient did heart surgery in Apollo Mumbai and still she's using medicine which is prescribed by doctor. Yes, you will need to take tablets for life as I've already mentioned. How do you beat fatigue after heart surgery? You just need to take up an active lifestyle. There is nothing much about fatigue after normal heart surgery. So, yeah, as I already mentioned, patients who undergo open heart surgery take much longer to recover. They take about 3 months to get back to normal life. Whereas with minimally invasive surgery, within 2 to 3 weeks, they're back to full normal activity because there is no bone fracture and the trauma is much less. So in 3 months down the line, they should be able to get back to full normal activity in minimal invasive much sooner. Will my diet be restricted after bypass surgery? Yes, as I've already mentioned. Yeah, please keep bringing in questions. I might have missed some yearly. If I have, please retype them now. This is the time to go on. What can be done to prevent occasional minor chest pain? So, as I've said already, if you have any of those risk factors, please seek medical help. And on a in this time of lockdown, it may not be emergency. You can do it on an elective basis. But if you have repeated chest pains which is not settling, then please seek medical advice as early as possible. And as I would like to repeat again, during this time of lockdown, if you are in doubt, please make use of teleconferencing facility provided by health travelers worldwide, which is something that will alleviate your queries and problems. Is it good to take coenzyme to prevent coenzyme Q10 to prevent heart problems? I'm not sure about this. Um, I haven't come across this being a preventive factor. There are various, as I've already mentioned, there are various treatment modalities and Ayurvedic modalities that have been tried, but there is no evidence to say any of them work. We see patients from time to time who have tried various modalities and coming up very late when not much can be done to get them back to normal life. If you have any problem regarding your heart, please seek medical help yearly because this is one of the diseases that can be treated unlike many other diseases which may not have complete cure or treatment. So please seek medical help yearly. Do not deny yourself a normal, perfect life. Is it possible for young, healthy people in 25 to 30 to die of a heart attack? It is possible, it's still rare. Under 40 is still rare, but as I said, we are seeing increasingly young patients having cardiac problems. An aunt of mine has a shrink in her bicuspid. Any suggestion to her for a healthy heart? I believe you are talking about a shrink in the bicuspid aortic valve, which is usually the case. If it is, they have to keep about 2 to 3% of the population are born with a bicuspid valve. Patients with bicuspid valve, most of them will have a problem with narrowing of the valve over the years, usually by middle age. Very few get away without problems. Keep consulting your cardiologist on a regular basis and take precautionary measures. There have been tablets that are tried, but none of them have shown evidence to say that can prevent shrinking of the valve, but there's no harm in trying statins or such tablets. So, yes, I would like to answer more questions that might have come up earlier. How do we differentiate between gastric pain and chest pain? Good question, yes. So, that's something I think we should have addressed earlier. Good to have brought that up. So, the gastric pain and chest pain, it's very difficult to differentiate. The nerve supply to the upper part of the stomach and the heart are very similar. So, gastric pain is because there is a surge of acid within the stomach, which then affects these nerve endings that leads to those nerve endings cause the pain. Because it's the same nerve supply, it is similar to the presentation of the heart. As I mentioned earlier, it's like a burning pain or a crushing pain and radiates to the neck or the arms. So, if it is gastric, usually it will settle down with antacids, tablets, or antacid liquids. But if it keeps coming again and again, and it's usually following a spicy meal or a hot meal, but don't put it down to that. If it keeps repeating, please seek medical advice. Make sure it's not the heart. If it's not the heart, well and good, then it can be easily treated by gastric medications. So, always, if we take care of the worst, the low minimal problems can be treated very well. So, we have to address the worst and make sure we don't have problem from the worst scenario, which can be life threatening. Why are we giving so much importance to the problems of the heart? Because it can kill patients. Other problems often do not do that, in which case they can be treated over a period of time. Please do not take cardiac problems easy. And as I've said, you don't have to always have fear of open heart surgery. In this day and age, very few patients need open heart surgery. A lot of patients can be treated medically or by catheter interventions, but catheter interventions are not suitable for a lot of patients with diabetes, poor heart function, or multiple vessel disease, where minimally invasive surgery can be used to treat most of these patients. Very few patients will need open heart surgery. So please keep the fear factor out, seek medical help, and take rational advice to help prevent major catastrophe to you and your family. For a bicuspid shrink in the aortic valve, would you recommend surgery? Only when patients are in, if it is a moderate to severe narrowing. So there are various factors which we have guidelines to follow. So commonly these patients can present with the same cardiac problems, chest pain, shortness of breath, or faint attacks. If you do get any of these symptoms, please seek doctor's advice early. And most of these bicuspid valve diseases can be treated without open heart surgery through minimally invasive cardiac procedures. Assalamu alaikum, alaikum salam. You did surgery 3 years before. My heart pulse, that is Syed Ibrahim, hello. My heart pulse always around 100 and 110 often. Okay, that is a little on the higher side. If it is so, please do not hesitate to contact us, surgeons, or our cardiology team. I am sure you're seeing us on a regular basis. If you're not, please see us on a regular basis as we advise. We will have to make sure your heart function, the rate comes down to within normal limits. Mr. Arasu, what is the difference between a normal chest pain and a pain before heart attack? As I have mentioned earlier, it's a central chest pain, commonly crushing or like some heavy pressure on the chest, radiating to the back or the chest or neck or arms, and usually associated with factors such as fear, sweating, sense of discomfort, vomiting, but this is not always the case. This is usually the case. If these any of these symptoms arise, then immediately seek medical help. But even any other chest pain that you get on a recurrent basis repeatedly, which is not usual, not something you have had earlier, then it's better to seek medical help than considering it as insignificant. Right, it's about three quarters of an hour. I'm not seeing much questions now. I think that's been a good session. I would like to thank Health Travelers Worldwide for giving me these opportunities. And you can always get in touch with the Health Travelers Worldwide through teleconferencing, or you can also see me through my website or Google Dr. M Yusuf. My website is Mix Society, micsociety.com, which has a lot of explanations about the minimal invasive surgeries that we perform. And yes, there is some. What are the uses of taking Cardiovos tablet? Cardiovos is a tablet which is has that's a brand name. It is carvedilol. It is one of the tablets used to slow down the heart. It helps in function of the heart because the heart function needs to be for it to be as best as possible. It needs to be pumping within a certain rate. So Cardiovos helps in that direction. Good. I'm seeing a lot of thank yous, so that leaves a big thank you to you all. Please take care. Do not hesitate to contact medical help, especially during this lockdown. Do not feel left out. And one final question. I think the sir tell me about hybrid surgery. Yes, that I can narrate a lot about it because we are one of the biggest numbers in the world performing these procedures, one and the only in the country. So this is combining best of both worlds. Hybrid, as you know, is a term given to best of few worlds. So in this case, best of cardiology and cardiac surgery combined together to treat patients without having a major open heart surgery. So it avoids the big cut and the surgery. So especially in treating patients with multiple blockages in heart vessels. So the proven benefit on the long term is in surgery over stenting is because we use arteries taken down from the chest wall and that are used to bypass the blockages. The blockage, it's like building a bridge across a blockage. That's what we do in surgery. So whereas in stenting, foreign body metal stents are used across the block like a spring and opened up. That's the reason the longevity is much better with surgery as opposed to stenting. And when we use arteries, which are natively used to carry blood to different parts of the body, that has the best longevity. From the evidence that we have, we know at 90% longevity over 20 years of age in most patients when we use multiple arteries. We almost always use one artery from underneath the chest wall in almost every patient, and both on either side of the chest wall in patients who are under 60 years of age. That is my practice. That is the recommended guidelines for most patients. And we can do that through minimal invasive surgery using robot. And when that happens, the right side of the vessel is usually allowed to be stented by cardiologists. In elderly patients, the main vessel is taken care by surgeons, and the other two less important vessels are taken care with stenting. This way, we make surgery shorter, best suitable to the patients, and in much higher risk patients as well, we can provide these hybrid surgeries and patients go home quickly with the best of both worlds with benefiting the most. So this is the surgery of the current and the future. We have performed more than 100 cases in our center, and as I said, we have one of the highest numbers in the world as well. So thank you very much, audience, and finally, thank you, Health Traveler Worldwide. As I said, you can seek medical help, and you can look into my web page, Google page, or Twitter account, as well as Facebook account, and the Mix Society, Dr. M Yusuf. And please make use of Health Travelers Worldwide teleconferencing facility during this time of lockdown. Please do not be left out. There is medical help available everywhere, and there is a lot of help provided by the government offices as well as private sector. Thank you.